My name is Megan, and I will be performing my persuasive speech on the importance of flu vaccinations. To most healthy people, the flu does not present any significant health risk. Those who contract the flu usually spend a couple days on the couch, feel very achy, have a fever, and are sick to their stomachs. For others, however, it can cause serious problems, including death. Even healthy people with the flu can become very sick and spread it to others. And the flu is very contagious and can become grave for those who are more prone to its exposure. The flu can be contracted in a variety of ways. The flu is spread by close contact with others. The virus is housed in the back of our throats and nose, so when we breathe out, we push the virus out into the air, and those who breathe the same air can contract the virus that way. Also, if we do not wash our hands carefully, we can carry the virus on our hands, and if we touch an object and someone else comes by later and touches that same object, they can also contract the virus that way as well. Around this time of year, the flu spreads from person to person, circling through the population. An annual flu vaccination is the best way to reduce the chances of contracting the virus and giving it to others. The more people who receive the vaccine, the less likely they are to contract the flu, and less likely they are to spread it to others. You can receive flu vaccines in two different forms: a shot or a nasal spray. The flu vaccine causes antibodies to develop in the body after about 2 weeks of the vaccination, and these antibodies provide protection against infection with viruses that are in the vaccine. Flu vaccines usually cover the 3 most common strains of the flu that are the most common throughout the population. You can go to several different places and facilities to get your flu shot, such as doctors' offices, clinics, health departments, your pharmacy, and urgent care, or even your school or work sometimes offer flu vaccinations as well. High-risk patients may suffer complications and are very highly recommended to have a vaccine. Those who are high risk are pregnant women, people who are 65 years or older, people working in or living in nursing homes, anyone over 6 months of age with chronic heart or lung conditions, including asthma and long-term kidney disease or liver disease, diabetes, or any condition that may weaken the immune system, any neurological symptoms or conditions such as multiple sclerosis or cerebral palsy, a problem with your spleen, for example, sickle cell disease, or if you've had your spleen removed. Those who are not in the high-risk group are also encouraged to receive a flu vaccination as well. Any person in close contact with someone in the high-risk group, such as main caregivers for elderly or disabled people, or people that work in certain positions such as poultry workers, should receive the flu vaccine as well. Some long-term side effects can be serious and can result from contracting the flu to those who are much more prone to the disease. And they can include viral pneumonia, sinusitis, bronchitis, post-infectious cough, ear infection, extended weakness, and even death. According to the CDC, between 1976 and 2007, estimates of flu-associated death in the United States range from as low as 3,000 to as high as about 49,000 people. During the regular flu season, about 90% of deaths that occur are in people who are 65 years in age or older. Receiving a flu vaccine can not only prevent the circulation of the virus throughout the population, but possibly save a life. By getting vaccinated, you can help prevent the spreading of the virus to those higher risk patients and prevent hospitalizations, long-term effects, and possibly fatality. Thank you.